Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Now celebrating 17 years of broadcasting success, here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again, both for our radio audience here in Mississippi at WYAD 94.1 FM and WYADonline.com. We're glad that you all could be with us. Also, just tuning in through our friends at iHeartRadio and Amazon Music Podcast. We're glad you all could be with us as well. This is part of our For Your Health segment. Approximately 34 million people in the U.S. have diabetes. I have some of them in my family, and 20 to 25% of them will experience painful diabetic neuropathy symptoms that can significantly worsen their quality of life. Now, this can impact everything and include tingling, burning sensations, as well as numbness. And this is something that then affects just everyday things, like my mother has problems sometimes getting a good night's rest. It also can impact driving and even walking. Well, people with this condition now have a non-drug solution that can provide an alternative to conventional medical management. Here to talk to us more about that in our For Your Health segment, we're excited to welcome Dr. Erika Petersen to our program, and also one of her patients, Lee Cagle. They're going to talk to us not only about this, but also where you all can go for more information. Thanks to the two of you for being on with us. Really appreciate it.
Thanks for having us.
So, Dr. Petersen, I'll start with you. This is something that definitely hits close to home for myself because I have family members that are diabetic and have dealing with some of these symptoms I just mentioned. Tell us more about this condition and the struggles that it brings people that are suffering from it.
Sure. So, as you said with the rundown on numbers, a good number of patients, we think about 8 million in the U.S., have painful diabetic neuropathy as a consequence of diabetes. And unfortunately, about 88 million Americans are pre-diabetic. So there's more diabetes that we're going to see in the next decade or so. And some of those patients will develop these symptoms, which, as you described, the painful numbness, burning, difficulty with sleep, difficulty with being able to work or even move around, really affects people. And it has to do with the fact that the glucose levels, the sugar levels in the blood end up causing tissue damage, and that includes the nerves in the feet. And when the nerves are damaged, they don't know what to do other than they're numb and they hurt. And medicines don't help to block that pain. And so we looked for an option that might be a non-drug way of trying to address that nerve damage-related pain.
Yeah. So talk to us about that. It's called HFX, and, of course, you'll be able to explain that more to our audience. How does that help when it comes to dealing with this?
Yeah, so HFX for PDN is a spinal cord stimulator. It's been FDA approved just over the past month newly, and it's the only one approved for PDN. The idea here is sort of like a little implanted pacemaker for pain. There's a battery pack under the skin and then wires that travel from that underneath the bone in the spinal column to deliver an impulse that disrupts these nerve-damaged pain signals from registering in the brain. What it does is it sort of jams the signal so that people who are affected by this pain don't have the same bothersome, annoying and disrupting symptoms of pain when the stimulator is working. And in our research, which was what led to the FDA approval, we showed that patients had more than a 76% improvement in their pain, and more than 80% of people that we studied in the research had a significant improvement in their pain. So it really is a big difference from a lot of the side effects and lack of benefit that medicines in the past have shown with medication.
Dr. Petersen, I mentioned that one of your patients, Lee Cagle, is here with us as well. Lee, if you don't mind, I'd like to ask you a couple of questions. How were the symptoms of PDN impacting your life, and how has this HFX, how has it helped you?
Okay, so I'm type 1 diabetic, and I've been diagnosed 3 years now, and so it's kind of late in life. And so when I first got my numbers under control, the PDN kicked right in. Like, I was like in miserable pain. I went and saw my primary care. He sent me to a neurologist. The neurologist put me on this thing, and he said, yep, you got neuropathy. And he prescribed me some pain medicines and never checked up on me again. And with that, I was kind of disheartened, and I was like living with this miserable pain. I created a tent over the foot of my bed to keep pain from the sheets just rubbing against my legs from hurting me. And then to my benefit, Facebook suggested this trial study to me, and that's when I was able to get on this trial on the trial study for this that's just now been approved, and it's changed my life tremendously because, I was miserable. No one wanted to be around me. I didn't want to be around anybody, and, now I'm back to my normal self again.
Yeah. So, Lee, let me ask you, what do you normally tell people? Because I know they probably have seen the difference. What do you normally tell them? Is this something that you've been recommending to others that may have had the similar symptoms and condition that you had?
I know a few diabetics, just through passing, and they're still talking about how their feet are hurting or whatever. And as soon as they start saying that, I'm like, hey, I've got this HFX device in my back, and I show them the little scar that I have, and where the little battery pack is at, and I show them the little one where they went up to put the leads up in my spine, and he's like, that's not bad. I'm like, no, and it's amazing. It's amazing how well this thing works, and the benefits. My quality of life has increased tremendously, and I've talked to 3 or 4 people, and they're all interested in it. We're waiting for FDA approval, so I'm going to let them know that it's been approved now, so they can start getting themselves taken care of.
Wow. Well, thank you so much, Lee, for sharing your story, and I'm so glad that you have been able to find relief. And again, for those who are dealing with this painful diabetic neuropathy, or as we've been calling it here, PDN, it's great to be able to know that this option is available. So, Dr. Petersen, how can our audience learn more about HFX?
Yeah, so it's always important that patients talk about their individual situation with their physicians, and make sure that they're really it's the right choice for them. But they can get more information off the internet the way Lee did. There's a website, hfxforpdn.com, that has a lot of information specifically about the FDA-approved device, and they can start there with a little questionnaire and then take that to their doctors and start talking about whether they should go forward with this as an option, and if so, an interventional pain doctor that does these procedures, or someone, the neurosurgeon like me, who would do the procedure, actually implant the HFX device.
Love that. And we will be linking that website up for our audience. Again, that's hfxforpdn.com. Again, our guests for this segment have been Dr. Erika Petersen as well as Lee Cagle. Thanks to the two of you for the time. I really appreciate it, and looking forward to having the two of you back on the program again.
Thank you for helping us spread the word.
Hey, glad to do it. It's my pleasure. And we thank your audience for tuning in to another great segment of Conversations Live. Until next time, I'm your host, Cyrus Webb, saying, as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Now let's go make today amazing. Take care.